All right, in today's lesson, we're going to take a look at levels of prevention. There are 3 levels of prevention: primary prevention, secondary prevention, and tertiary prevention. When we look at primary prevention, we're talking about true prevention. So this is a first level prevention. This is going to be in healthy people, healthy individuals. So if someone comes to you and they're like, hey, I want to learn more about stroke prevention, you'll talk to them about risks for maybe high blood pressure or the risks associated with smoking. These are risks that we would try to inform the patient of so that they can avoid them. Other methods of primary prevention are vaccines, exercise, nutrition, education. These are just some examples. Secondary prevention, the goal here is to prevent exacerbation of disease or illness. So we're always looking at someone who is sick. So we're going to talk, let's go back to our stroke patient. So you get your stroke patient has a stroke. What are we going to do? We're going to do CT scans. We're going to hospitalize them. We're going to make them stable. What we want to do is we want to get a diagnosis and prompt treatment because we want to return them back to their previous level of health as quickly as possible. The other thing that falls into the secondary prevention is screening. So we'll do some early screenings, some frequent testing, and we want to make those interventions early so that we can prevent the stopping or spreading of a disease. And so we want to limit the disability there. So last is tertiary prevention. And the goal here is focusing on management. So this would be, if we go back to our stroke patient, we have our stroke patient and let's say they have some deficits. We want to minimize the effect of the disease. So we want to get them eating and drinking again. We want them using their hands. We want them speaking. We're going to focus on maybe some speech therapy. We want to help them turn. The goal here is to prevent deterioration. We don't want them to get worse. The caveat with tertiary prevention is that the illness is irreversible and sometimes debilitating. So what we want to do is focus on patients like who are in rehab or who are in maybe palliative care. This is where tertiary prevention comes in. We want to basically prevent them from getting any more worse off than they already are. We want to minimize the effects of the disease and focus our efforts on rehab. We talk about levels of prevention. We want to focus on promoting health and wellness, and we also want to focus with our patient at the center. And we can definitely do that through levels of patient education. Okay, so let's recap. When we talk about levels of prevention, we've got 3 of them, 1, 2, 3, primary, secondary, and tertiary. Primary focuses on prevention before something happens. Secondary is about early intervention and getting the patient back to where they were, or at least as close as they were before. And with tertiary, we want to work to manage the disease and minimize the effects of the illness or injury. Well, that's it for our lesson for levels of prevention. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.